Hi everyone. So it's been forever since I've had any sort of video updates, mostly because I've not had much to report. I've got my nifty shirt that I never wear because in no way do I have impulse purchasing issues. Actually, it's laundry day and this is clean, so there's that. Anyways, recently I had a total hysterectomy done. Ovaries, fallopian tubes, all of it. I had it done by Dr. Amy Brenner in Westchester, Ohio, and the procedure was the laparoscopic Vinci assisted, so robotic. So no big incisions, very tiny and minimally invasive, all that good stuff. So I've only got the 4 tiny incisions. This wasn't really something I was planning to do at this point in my life and transition. But in the past I'd had severe problems with endometriosis, ovarian cysts, ovarian torsion, which was basically a cyst so big that the right ovary would kind of twist over on itself, which is extremely painful. And it would never completely tore so that the ovary would die, because I would like that. It would just cause a lot of pain, and then after making me extremely sick and nauseous, fevers, I would, it would untwist, and I'd still be sick, but not in any real danger. So that ovary needed to go, and for some reason, most of the symptoms of the endometriosis came back after almost 2 years of complete cessation from the testosterone. I'm not sure what triggered it, but I started having the bladder problems, the pelvic pain problems, the digestive issues, the fatigue, and I was just done. I wasn't very useful at work. I pretty much never call off, but I called off once. I was stuck in a less physical area, so it wasn't very useful. So I was just decided I was going to get this done if I could get it covered. My insurance didn't fight it at all, strangely. Dr. Brenner got me in. I called as a new patient on a referral from a friend of mine who had the same procedure. But she got me in the next day, and then we scheduled surgery only 3 weeks out, kind of on an emergent basis because of the pain and the cysts. And they filed it with my insurance company, which is Humana. It's an employer plan, a PPO through work, and they had it approved in under 24 hours. So, pretty impressive. I'm just responsible for the deductible. So, good news. They originally told me to anticipate 2 weeks off work, even though I explained that my job is pretty physical. Maybe 3, some people might need an extra week. Okay, that turned out to be utter bunk. I don't doubt that there are people who can go back to work after 2 weeks, but that was certainly not my experience, and not the experience of a lot of guys I've talked to. Maybe we're just wusses. I don't know. I don't think I am. I don't think I was playing this up, but I did have complications, which I'll get to. The actual surgery went really well. I'd had all the pre-hospital admission testing done by my general practitioner like a week and a half before, so that was all done. Got to the hospital. There was a delay with surgery because her first one ran late. But as for my procedure, I was told, my brother was told by Dr. Brenner, because I was still too out of it. I barely remember recovery. I was told the procedure went extremely well. It was one of the easiest ones she'd ever done. It had only taken an hour, da-da-da-da-da. And, I wasn't in that much pain when I came to in my room. They gave me a Percocet orally. I wasn't on IV pain meds at the time, just an antibiotic. And I was eating after and feeling okay. The swelling didn't look too bad. The incision sites were bruised, but not, anything too horrific looking. but it was supposed to be outpatient. It was the sort of situation where if you had the surgery in the morning, as I had, and by 3 or 4 o'clock you've met all these milestones, which is, you know, they want you to eat, pain be managed without IV pain meds, obviously, and they want you to get up and go to the bathroom. They place a catheter while you're asleep, a urinary catheter, but they pull it before you wake up, so they want you to be able to pass urine unassisted. I couldn't do that, but that was the least of the problems. What happened was they helped get me up to go to the bathroom, and I started hemorrhaging all over the floor. Vaginally, just passing clots the size of, like, golf balls up to lemons, and multiples. It turned into a real shit show, real close, real quick. The personal care attendant who was helping me up kind of bolted for the nurse's station, and I'm just sitting on the toilet, just kind of dazed, like, you know, what the hell is happening? And there's a full-length mirror in the bathroom across from the toilet, and I'm looking, and I'm like, what the fuck happened to my hip bones? Like, I don't remember my hips being that close together. I mean, that'd be nice if I didn't have, you know, wide hips, but I kind of do. And I stood up, and I looked, and I'm like, oh shit, those are not my hip bones. It was where the 2 incisions just north and inward of the hip bones were, both had hematomas, like big egg-shaped hematomas sitting on top of them, so it looked like bone protrusion. So that was freaky. I mean, it was ugly. I actually got a picture when I was laying down. Yeah. So, somehow that looks like a really fucked up nipple, but it's not. That's my hip while I'm laying down. You can see the... Okay. That. And then a week later, you can see all the bruising. It looks like I got kicked by a deer or something. So obviously I wasn't going home with all the bleeding. Dr. Brenner was in another surgery downstairs. They had to call her up to do something about it because I was losing a lot of blood. Probably, yeah, somewhere over 3 pints, they're thinking. My hemoglobin level was about half, a little over half what it was when I came into the hospital. And really, I probably have the testosterone to thank for not requiring a transfusion, because my hemoglobin was higher than is typical for a female because of the testosterone. And if it sinks below like 8, my level was 17 when I got in the hospital. It was around 9 when they last checked it. If it had gotten any lower, if I had had less to lose, they'd have needed to transfuse, which I was trying to avoid. But Dr. Brenner was great, though. She basically manually evacuated the clots, which, that sucked. I mean, there's no other words for it. I'm someone who historically hated gynecologist appointments. My blood pressure would be through the roof, just for a typical exam pap smear because of, you know, trans baggage or survivor, something. It's just a combination of bad experiences. So, of course, you know, the manual evacuation of the clots was pretty traumatic. You know, but once she did that, she used hemostatic paste and some packing, and it did eventually stop. It took several hours, but they didn't have to take me back down to surgery. Unfortunately, because they thought there was the potential need to take me back down to surgery, they had to take away food and water Friday night, so back to not eating. And then they had to place a catheter again, which was actually, including the time I was asleep, they pulled and placed catheter 5 times, Foley, 5 times, during my almost 3-day stay. Because they kept thinking if they pulled it, my bladder was going to start responding. But it didn't, and I was like the only one not surprised by that, because I've had bladder issues in the past. I was just like, oh, well, it's pissed. They're like, oh, well, if we give you another couple hours, I'm just like, yeah, probably not. And I was right. Being right was absolutely no fun, though, because they still had to, yeah, pull in place catheters, which if you've had it done while you're conscious, it sucks. If you do it 5 times, it sucks more. And to add to my joy, my IV blew Saturday morning. Operation was Friday morning. Saturday morning, I noticed my wrist was about twice the size it should have been. I was like, okay, is that normal? No, it blew. So throughout the day, they were trying to get another one started to give me IV antibiotics. So they made about 6 attempts before I just said, I'm done. Having someone dig around for veins is all kinds of not fun. So, yeah, I was done. I don't want to be the problem patient, but after everything I went through, I was like, okay, and while we're at it, can we get some Xanax? So Saturday night, I finally got some Xanax because I'm just, like, stressed. I went home on Sunday evening. I had to go home with a catheter because my bladder was still being a little bitch. I didn't get it pulled until Wednesday. That's just what it was. I didn't feel like going anywhere or doing anything, and it was actually as much pain. I wouldn't call it... See, pain's not exactly like when people ask, oh, are you in horrible pain? It's like, well, compared to what I was with the endometriosis, no. That was way worse, but this is a kind of like soreness that from the severe bruising, which really went all the way up to my ribs, and my ab muscles just felt completely shredded. Like way worse than doing ab ripper X or like hundreds of sit-ups. It was extreme. It felt like I'd been in a car accident, basically. So I didn't want to get up. It wasn't the kind of pain when resting, laying down, I needed. In fact, I stopped taking the Percocet the day after I got home because it was making me constipated and making me throw up. So I don't tolerate opiates very well. So I gave up on that and was just with the ibuprofen and aspirin and Tylenol and rounds. I mean, but I didn't want to do anything, so the catheter was just kind of an excuse to lay in bed and not get up as much, which was fine because for the first few days I didn't want to do anything. I went Wednesday to have it pulled. That all went fine. I was able to pee. Dr. Brenner still said she had no idea what had caused my bleeding. I mean, there was always the possibility she'd missed a blood vessel when cauterizing. Based on what I saw with the IV, because they'd come back when they couldn't get it and try again and pull the cotton ball and Band-Aid off, and when they do so, it would bubble back up, even if it had been hours. Now, that's not normal, especially for me. Plus, the severe bruising and hematomas, that's odd. So they're thinking I have a clotting disorder, which, you know, pretty soon I'm going to go back to my GP and have some clotting tests run. I have MS, multiple sclerosis, and I've had symptoms that didn't quite fit with that, but were kind of seemed autoimmune. Also, endometriosis is known to be autoimmune, or believed to be. So the chances that I have lupus or another autoimmune disorder are significantly higher than most people. My risk factors put me way up there. So, other than the initial complications, I've been healing just fine. Like I said, today's 4 weeks. 2 weeks was really the turnaround for me. I don't understand how people went back to work at 2 weeks. At 2 weeks, I just felt okay to try driving in short bits with a pillow on my lap. Like, it, I didn't do any, the first 2 weeks, I mean, stairs were kind of hard. Sitting up was miserable for at least a week and a half. It just wasn't possible without a lot of support behind me. I guess, yeah, 2 weeks I went to Pride for a little bit, but it wore me out. You know, I just don't have the stamina that I used to. I'm actually back to work. on Monday. So in a few days I go back to work. I'm on light duty. I have a 10-pound weight limit for another 2 weeks. I've actually, starting the other day, I started doing a little bit of low-impact cardio, elliptical on a very low setting, in like 15-minute increments. And I've been taking like 4-mile walks. Walking seems to be okay. Even some like light trails in the woods, hiking, I'm okay with. Running is going to be a definite no for at least another month. Weightlifting, obviously, until my restrictions up on the 29th. So, you know, recovery's pretty good. Scars look like nothing. I'm actually really happy with this. I don't know how to... Yeah, my stomach's still puffy. Like, this isn't what my stomach normally looks like here. This is definitely some swelly belly, as they tend to call it. But if you can see, there's an incision. One's in my belly button, which you can't really even see because of all the swelling. There's one, and there's the other one. So at this point, they kind of look like cat scratches, which is nice. That's one thing I can say, is at least I don't scar too badly. It's kind of interesting. Oh, I'm not going to shut over. Okay. It's, sorry, the light's kind of, there we go. You know, my friend had warned me about the psychological effects, how it can be kind of head trippy, even if, you know, you weren't planning on having children yourself, you know, just the finality of not having eggs anymore. I mean, even though we all know what's required to harvest them, you know, going back on female hormones, which is inconceivable for a lot of us. And particularly, you know, with my medical issues, that was just not an option. But nonetheless, like, I was a little worried it was going to affect me that way, and it really hasn't. Maybe it hasn't hit yet. I was too busy being, you know, just completely laid up. But, you know, that gives you a lot of time to think. I mean, really, all I've been doing is rewatching, like, the entire series of Buffy the Vampire Slayer, so, yeah. I've had plenty of time. The only thing that's really getting me is my coworker, who is older, has a grandkid, has kids of her own. She had the same procedure done about a month and a half before I did. And, you know, everyone's responses to her are very different than mine. And, you know, it's... You know, people are just trying to be helpful. They're like, oh, you're trans, this is part of your journey, this is what you want, you know, this is a validating experience for you. But what I'm hearing, you know, is, oh, you're a guy, so this is good, but your coworker, we're going to apologize and just feel sorry for her because she's losing part of her identity as a woman in losing her uterus, which I think is absolutely ridiculous. You know, likewise, there would be some trans guys who would feel a loss about this. I don't really, because I know that I exhausted every avenue in treating these conditions. If 2 years of testosterone wasn't going to stop it, nothing was. You know, so I feel pretty good about I won't have these problems, I won't have the cancer risk. You know, I won't have to go to these embarrassing appointments where I sit in the waiting room and everyone just stares at me. I mean, I probably don't make it easy for myself with nail polish and stuff, but, you know, it's still awkward. Plus, you know, they charge a $50 copay because it's a specialist. I'm sorry, but if half the population has to see this doctor every year, that's not a specialist. That's some bullshit. But yeah, they're working on the insurance things, which is another thing. Like I could get, I can change my health insurance plan. I'm listed with them as female currently. I could change it to male. I can change my stuff with my documentation marker with the Social Security Administration. If I get a note from Dr. Brenner, I don't really care about that. It's not really important to me. So, but all in all, I mean, it wasn't a bad. Well, parts of it were a bad experience, but you know, Dr. Brenner's fantastic. Always got my pronouns right, was correcting other staff and nurses on pronouns. You know, just very, very supportive, not belittling like a lot of gynecologists I've been to, has no problem with listening to your opinions on things, because typically if you're young, a lot of doctors won't even consider hysterectomy. And it's not just because we're trans. Other people with, you know, female gender identity with these problems, she would consider hysterectomy too, if that's what the patient wanted. So that's nice. Their insurance people are wonderful at getting stuff taken care of. I was at Westchester Hospital, which is actually pretty nice. It's like 3 years old. It's all private rooms, which is good, given my situation. I had some gay staff come up and introduce themselves and say, we just want you to know you've got family here. If you need anything, let us know. If anyone's not getting anything right, you know, we want to know about it so we can do better. I mean, it was just very, it was very validating, you know, whilst I'm laying in a pool of blood. You'd be surprised how the little things can help when things are going pretty poorly. My family was really supportive. My brother even stayed the night at the hospital. Saturday night when I was having such a time with the IVs and catheters. At one point, yeah, my bladder got so full and they wouldn't drain it. They were too busy, and that was extremely uncomfortable. So everyone's been great. You know, I've had a bunch of friends checking in on me. So I wasn't expecting to have a month off work, but I got a doctor's note for that, so it's no biggie. Month off work. Oh, and there was one other thing I wanted to mention, because I feel like this doesn't get talked about a whole lot, and that would be changes in sexual function. Now, it wasn't really something I was super concerned about, you know, because you read, and I'd done a lot of research. I looked, specifically when in initial recovery, I was looking at a website called Hyster Sisters, which is just like all hysterectomy support. I didn't make an account because awkward. I don't really feel like, you know, it's a very woman power space, and I don't want to encroach on that, and also I just don't want to, it's not worth explaining things, and I can just, pretty much everything's been asked there before, so you just, you know, research it. It's a really good resource, if you're in the same position or researching, still, the procedure. But I'd seen thread after thread of can't orgasm anymore, orgasm doesn't feel right, or, you know, all this sort of thing, and that wasn't like a major concern to me, being able to orgasm, particularly, because 2 days or 3 days post-op I had a sex dream and woke up having an orgasm, so that was a little freaky simply because I'm like, oh shit, stuff's gonna start falling out. It didn't, but you worry about that. You're like, I don't know if I want any more blood flow to that area, given everything that's been going on. Just kind of back off of it for a while. But the first time I purposefully had an orgasm was like 2.5 weeks after, and everything's fine. It does feel different, but since uterine contractions had typically caused me pain afterwards, it's not a bad change, I would say. But I've definitely read a lot of things that a lot of people tend to miss the uterine contractions. I don't. It still feels good. It's not like I came and was just like oh shit, what was that? No, I mean, doesn't disappoint. And now it comes without the, worrying about being pregnant, or, worrying if you've got cancer, if there's something going wrong, pain, which led me to believe that, I'm without a doubt there's something to uterine contractions, uterine orgasms, but from what I was saying, and here goes the, psych minor in me, a lot of the problems seem to be psychological. What I was reading in these women's other posts was a lot of, they got the hysterectomy under duress, they didn't want it but didn't have any other choice, they weren't completely done having children, in a lot of cases they'd had cancer, or couldn't have hormone therapy for another reason, and so they had so much negative feelings about everything that had been done that I'm pretty sure that was the block there. And I can see that because, for a couple weeks I was feeling completely not wanting to deal with any of that stuff myself, but I'm a horn dog, so, that wasn't going to last long, and I knew it. I was aware. I was like, oh yeah, well, that won't last. Even though I'm not on testosterone anymore, which is another thing I wanted to talk about. And this is the longest video ever. I'm gonna have to split this into parts, probably. I don't know, it's been so long, I know YouTube does longer videos, but you probably have to pay something. Anyway, I'm not on testosterone anymore. About a week and a half before surgery, I just stopped doing the injections. A lot of studies I'd read had said that testosterone actually impedes healing. And additionally, I just, I don't know, I'm coming to a point where I really like looking andro. I'm identifying with it more. I don't know if I'm comfortable appearing more masculine than I currently do. And I was starting to finally get a few chin hairs. The rest of me is tragically hairy, and that doesn't bother me as much. For some reason, the facial hair was like, whoa, no. Plus, my hair is thinning in the back, and I got really sick of that. My skin, even with an antibiotic after 2 years, has just not stopped breaking out. My back, still get the cystic acne. It's better, but the main reason I was on it was to keep the endometriosis symptoms at bay and not get a return of bleeding and stuff, and that's not an issue anymore, so for a while I'm just doing a complete clean slate, no hormones. The worst of it thus far, because it's been about 6 weeks since I've had a shot, has been hot flashes, but it's summer and I'm going to be uncomfortable anyway. That's just how it is, so, if that's the worst of it, big bad deal. I do intend to probably go on a low dose of tea again at a later date, once my hair's had a chance to catch up and I can get a prescription for Propecia. Howard Brown, where I go for my hormones, they're very awesome about all of that. So they don't care that I'm off of it. They're like, oh, do what makes you happy. And for now, I kind of feel like being on nothing is the best, and then we can just gradually ease me on to a low dose later. I really don't want any more changes. My sex drive's still good. I don't think fat's going to revert back. Without the presence of estrogen, I think it's pretty much just stay where you are kind of thing, which at least currently is what I'm comfortable with. I'm definitely identifying on the genderqueer side of things now. Androgynous was actually what I identified with before trans, and it's still something that speaks to me. So, for the time being, I really don't want to, masculinize any further. I'm a little concerned about losing muscle, can't see, muscle density, but I think a lot of that, since what I've built is lean muscle, is just, continuing to work out, which obviously I haven't been able to do, but as soon as I'm able, I'll be back to it. That's not an issue. So, just for anyone who wanted to know stuff about the hysterectomy, overall, good experience. My complications were definitely atypical, and it's something with me. Dr. Brenner's fantastic, and most of her patients recover really quickly. I'm just weird. But I'm still glad I did it, and now I'm starting to catch up and feeling almost like myself again. So, a few more weeks, and I think I'm already feeling better than I was before the surgery. So, that's definitely a plus. But if anyone ever has any questions about Dr. Brenner, or the procedure, or, any of the aftermath stuff, or even endometriosis, any of that, polycystic ovarian syndrome, I am always happy to talk about that. So hit me up on either YouTube, or I think my email address is listed with them, or Facebook. I'm always happy to talk. Bye, guys.